Hi guys, David Sapker. I'm a cardiologist in Columbus, Ohio, and I'm part of an incredible system named Ohio Health. We have a leader within Ohio Health, also a cardiologist named Dr. Kevin Stiver. Kevin gives a wonderful talk this morning on telemedicine, something that is going to be part of our lives as cardiologists and part of your lives as patients. We're patients too. So please enjoy Kevin's very insightful talk. He is a great guy and brilliant. Have a wonderful Saturday.
Hey everybody, my name is Kevin Stiver. I'm an interventional cardiologist at Ohio Health in Columbus, Ohio. And I'm here to talk to you a little bit about more of the rapid changes we've been experiencing in virtual healthcare, and I appreciate the opportunity to be a part of this amazing effort. So just to give a little background, virtual healthcare is nothing really new to U.S. healthcare. Back in 2012, about 60% of organizations were using some form of virtual healthcare. This primarily was in the form of providing behavioral health services and psychiatric services to rural areas that didn't have access otherwise to these services due to a shortage in professional health caregivers to be able to provide these types of services to these areas. But even with that being said, we were experiencing a rapid growth with over a 5-year span, about 60%, another 60% of new institutions adopting some form of virtual healthcare, including my own institution. With that being said, however, we were still not giving enough attention to virtual healthcare as we were thinking about all the services that we provide to patients across America. In fact, the government, which we commonly think of as Medicare, as a representative of government and how people have insurance, was only spending about 0.01%. So 1/100% of all the dollars that we spend on healthcare, we were devoting that to virtual healthcare. The reason why behind that is rather complex and difficult to even explain from my own point of view. But as you can imagine, the benefits of virtual healthcare are quite vast. Not only does it provide access to such important services as psychiatric and behavioral health services, but when you think about a growing need of even such basic needs such as primary care, where 60 million Americans potentially live in an area where they don't have direct access to a primary care doctor, people were starting to recognize more and more that virtual healthcare could help fill that void. And if you can imagine even closer to now, where we are currently in the midst of a pandemic, where we recognize such important things to stay-at-home ideas and social distancing, we realized as a healthcare community, with the government support, that we could provide really excellent healthcare and meet people's needs over such services as a video conferencing idea or even over a telephone. So to support that, and not to bore you with too many details, the government passed a waiver called CMS 1135. And what that waiver did, which was actually under our president's National Emergency Act, it gave us the ability to really rapidly innovate and expand our services that we previously weren't able to do. So not only were we able to add new services, we were able to kind of cut through some of the red tape to be able to apply some aspects of virtual healthcare and develop such things as a video platform to be able to provide those services. You may have already experienced this in your own lives, and I wanted to spend the remainder of this talk really talking about how to prepare for a virtual video visit and really what the benefits are of virtual video visits, even as we kind of continue to move through this pandemic. So in regards to preparing for a video visit, as most individuals will be at home during these video visits, I just want to express the importance of really working with your healthcare organization to understand what it means to get your video platform set up, or what we need to help you with from your end to make sure that we are all on the same page in regards to potentially any technical difficulties and really what to expect. As you can imagine, as we go through using virtual healthcare, the idea of sitting down and making sure that we can be together to figure out how to get you on a video visit is important. But even as of today, where we may still be socially distancing between the doctor and you as the patient, we really need to make sure that the lines of communication are open between what problems you might be having with setting up a video and how we can help you with that. Getting past the technical difficulties of a video visit, again, because we're here to help you with that, some other important aspects are to make sure that you're in a quiet and calm environment, that you're able to sit so we can actually see each other, making sure that you have questions be ready to ask as you normally would for an in-person visit. The important aspects of a video visit are really several. From a physician's point of view, we can use the video to our advantage so that we can be able to perform a virtual physical exam by looking at certain key aspects of what potentially you might be wanting to talk about, such as a rash, maybe a mole, or, as a heart doctor myself, I can make sure I can understand swelling and get a better understanding of how you're doing. Not only from that end, if you have a home blood pressure cuff, I can, over the video, ensure that you're doing it correctly or answer any questions you might have about that. Another part that we can't do necessarily in the office as easily is that since you're at home, you will have all of your prescriptions with you at home, theoretically. And so we can actually sit over and take some time and go over all of those prescriptions you have to make sure that we know what you're taking and answer any questions for you. The second, probably most interesting thing for me is we're continuing to expand what we can do through video visits. So we're working with other companies to be able to think about how we could actually integrate or find better ways for your wearable devices. So not only blood pressure cuffs, but fit trackers or your Apple Watch, just as an example, and how to actually work with our computer system to make sure that those two things communicate seamlessly. Along those same lines, we're working with technology companies to think about how we could develop a stethoscope, as an example, that you could have in your house, but you hold it to your chest and then we can hear what it hears. Along those same lines, since we're meeting over a video platform, how do we potentially share our screen so we can share educational materials with you that then we can kind of go over with you in real time to show potentially things that we think you're experiencing, or procedures or surgeries or recommendations that we are going over, that we could actually kind of go over a kind of a cool way, and that actually helps both of us understand how we could apply those to your own health. In conclusion, if you will, virtual health has been an absolute amazing tool for not only our patients, but for our providers to provide care to patients and people in our communities through this time of need. One thing that we've learned is that virtual healthcare and video visits in particular is something that's here to stay, and we believe that we can continue to make it an easier and better experience, not only for you, the patient, but also for us, the provider, and provide care to you that meets your needs. So again, my name is Dr. Kevin Stiver. I'm a heart doctor here in Columbus, Ohio for Ohio Health. Again, thank you for the opportunity to sit here and talk more about this cool stuff such as we just went over. All right, have a great day.
Thank you guys. Have an awesome week.